Every day a child dies in Armenia, says the official data.
The child was already dead.
The country now faces a critical need in pediatricians. 86-year-old Yeva is the only pediatrician in the whole region.
I cannot leave these children.
Meanwhile, not all the pediatricians are so diligent. This kind of doctors should not be allowed to work. Today's critical topic of special reportage is about childcare issues and healthcare challenges of the new generation. Home alone. People, phenomena and events from an alternative journalistic view. Good evening, you are watching Special Reportage. Every day, one child dies in Armenia. This is not an unbelievable fact, rather official data. Infant deaths are predominantly observed among children under 5, while the studies say they might not have died. Today, pediatrics in our country is not just in bad, but in devastating condition, especially in regions where there are no specialists for children. Most of them should have already retired, while they still work as there is no replacement for them. Tigran Zarean has more. The newborn might have not died if they lived in a city. The newborn might have not died if the doctors remained faithful to their oath. Lucine and Arman might have had quite a different life if Lucine safely delivered her baby.
We hardly managed to take a car. The child was already dead.
The tragedy of Lucine Nerkin Bazmabert community is probably exceptional. Still, it resembles thousands of other cases. Every day a child under 5 dies in Armenia. This is official data. Yet according to non-official sources, the numbers are twice as high. 43% of these deaths occur due to so-called perinatal causes. Among the children under age 1, 70% of deaths occur within the first month of their life. Children mainly die due to preventable causes.
It would not be normal if no child death occurred.
Now the main gap in child healthcare system in Armenia is the lack of young specialists. According to the Ministry of Healthcare of the Republic of Armenia, 80% of the country's pediatricians are of 40 to 60 age, and only 13% are of 28 to 40 age.
We have problems in terms of human resources, especially in the sense of unfair distribution in regions and the capital Yerevan. Yes, we have lack of workforce, not only among pediatricians and obstetrician gynecologists, but also among other specialists. In this regard, we have a lot of work to do.
Young people do not want to become a pediatrician. The salary is low. However, those who dare to become a pediatrician think of leaving the country as soon as possible, as they don't see any perspective. They don't even consider working in the region. The doctor working in Amasya and serving 20 surrounding villages is the only and irreplaceable one. Dr. Yeva will soon turn 86. She is waiting for replacement for more than 10 years.
I cannot leave these children without care. It's my sacred duty.
It is 63 years she has been taking care of children. Thanks to her service, thousands of children have been cured. However, such a loving and caring doctor doesn't have her own children. She doesn't have her own family, partly because of her profession and partly because of the lack of time.
It was the biggest mistake of my life, the one I can't forgive myself.
Dr. Yeva was born on the first half of the 20th century in Baku. Having graduated in Baku, she used to work in Nakhichevan. In 1988, she came to Armenia. She was offered a job in Gyumri but had no place to live in. In Amasya, she found both the job and the apartment. Since then, she has been working in poor conditions and with low salary. Besides, the children are more likely to any other region of the country.
The climate is severe. The salary is too low. But as I am a specialist, it is my duty to work and to help.
The situation is bad in remote villages of the country. Pretty often, one aged specialist serves several communities. But where should the parents go? Who should the pregnant women refer to? It is too expensive and hard to go to Yerevan, while in the communities there are no specialists. Delivering a child has become even more complicated.
It is good to have specialists in the communities. Today we have the need, and the issue is left on the government, on the healthcare system.
In harmony with her husband, Lucine carries the heavy yoke of her family in Nerkin Bazmabert community, Tallinn region. Life in the village is hard. It is hard to carry the household chores, to earn for the living and to take care of the health. Today they have 2 children, but could have 4 of them. She was 26 when she first became pregnant. At 4 months she had a miscarriage. She says that it's the doctor's fault. In a year, Lucine again became pregnant. She and her husband were looking forward to the birth of their first child. They had even agreed on the child's name. Arman was getting money somehow to take Lucine to the hospital for the checkups. There was only one hospital and far from the village, in Tallinn. I took her to the hospital. The doctor said, "You can go, don't stay at the hospital. You still have some 1.5 months time." Next day, my wife delivered. The child died on the way to hospital. Arman and Lucine claim that the child died because of the doctor. It was the doctor's fault. And this is not the only case when the child death is considered as a doctor's fault. They say they met the doctor after the incident. She only apologized, hanging her head low.
Yes, it was the doctor's fault. If she had treated me properly, I could have safely delivered.
This kind of a doctor should not be allowed to work. They should be fired and that's it. If such a thing happens once, it will happen again and again. Overcoming the hardships and coping with the deaths of the 2 children, the couple again decided to have children. But this time, they decided not to apply to doctor. The village midwife helped her to deliver successfully. Now they have 2 children, 3-year-old Catherine and 2-year-old Armenag. Despite the several crying cases, the head of Mother and Child Healthcare Department of the Ministry of Health says that child mortality rate in Armenia is normal.
The child mortality rate is not a crying, sensational and dangerous problem in Armenia, as it is gradually decreasing and the decrease rates are maintained for the last 10 years.
26-year-old Irina is an exceptionally young doctor who consciously chose the pediatrician's specialty. Her aged colleagues are happy when they see her. Finally, they see a young doctor keen to carry night duties. It is not typical to see a pediatrician on night duties in the hospital. Irina is devoted to her work. She has even left her boyfriend because of her work.
You should not pay attention to how much you earn. Proper service should be provided, and it doesn't matter whether you are well paid or not.
In Armenia, children under age 7 should receive state-insured medical services. This is regulated by the law. But despite the law and the socio-economic conditions of the families, different amount of money is required in different hospitals of the country to provide medical services to children. This is why Ministry of Health, in cooperation with World Vision and UNICEF, has set up Child Health State Certificate Program. The most important component of the program is social justice, so that there is no difference between children living in poor or wealthy families, especially when it refers to children's health. The project also aims to eradicate out-of-pocket payments and to improve the quality of medical services provided to children. A newborn child will receive the certificate in the maternity hospital. A child already registered at the local polyclinics will get it thereof. Children from Marses can get state-insured healthcare services in the capital as well. The certificate will always remain with the mother, and if a child happens to refer to a hospital, his or her mother should not take her purse, but the certificate. We do have problems, but the fact is we are moving forward and already have positive feedback from the population. Exactly 10 years ago, Armenia signed the UN Declaration on Millennium Development Goals, MDG. MDG 4 is child mortality. Today, the experts recognize that the planned targets, which should be achieved by 2015, are not or are hardly achievable. Meanwhile, life continues, and ensuring healthy generation, one of the major problems of the country, is threatened. According to the calculations, in some 20 years we will have scarce number of pediatricians. This means that for the child's treatment we will not have to reach Yerevan from the village, but will have to go abroad from Yerevan.